And I've talked on multiple episodes of how that comes to play and how that is generated by chronic inflammation within the temporomandibular joint. But today we're talking about the symptom of burning tongue and what that has to do with TMD. So it didn't take long when I actually began to investigate the disparate symptoms of TMD to determine what the relationship is. So I'm going to try to share my screen here with you and show you something that I think is very significant. This is a diagram directly out of Gray's Anatomy. Actually 1953 edition of Gray's Anatomy of the lateral temporal bone, temporal and the glenoid fossa, to get you oriented if you can't see it already. Styloid process, external auditory canal, glenoid fossa. And I want to point out a anatomical structure that I've spoken on before, which is the petrotympanic fissure. Now, the petrotympanic fissure is a fissure that goes through the temporal bone, a fissure that's about 2 millimeters long. It is a potential opening because it is a fissure. It can be closed, it can be open, but a fissure is a potential opening between two structures. This fissure, called the petrotympanic fissure, is also known as the Glaserian fissure because it was described and written upon and put in the literature by Dr. Glasser in 1680, who is a Swiss anatomist. So it is known as both the petrotympanic fissure and the Glaserian fissure, and the location or entrance to the fissure is located at the posterior portion of the glenoid fossa, basically directly between the bones of the external auditory canal and the temporal bone, which houses the glenoid fossa.